Hi, this is Andrea Kane, and I'm here with you with HIT 352 Health Information Systems. We are now on week 13, which means chapter 13, security. We're going to talk all about security. Our learning objectives from your syllabus are 9.5.1 through 9.5.9. And if you want to follow along in your book, let us start on well, you could start on page 217, but I would suggest we move to page 218 where we really get into the contents of this chapter. Our learning objectives, according to the textbook, are to be about educating staff on security issues, discussing federal security regulations, recommending security measures, developing policies and procedures on security practices, controlling access to protected health information, or PHI, conducting audits for security violations. And so we are on to the introduction. Data classification, and where you're going to see this is right at the very beginning, top of page 218. It talks about how data can be classified in a number of ways. One way is to classify it according to type, clinical, administrative, financial, and so on. But it can also be classified into categories according to the level of security required. So good to know that. So one example is PHI, which is sensitive, versus public. And so you're thinking about how the information is used and what its contents are, as to how you're going to handle the security for it. And then it talks about how historically security regulations were enacted at the state level, and HIPAA really came in and tried to make those more consistent across all states. And again, you had the state laws that varied. You had some that were really strict and some that were basically non-existent. And HIPAA comes in and says whichever is the strictest law between HIPAA and the state laws, that's the one you always follow. And as we know, with studying HIPAA, there are a lot of security regulations in HIPAA that are there to govern how data is used and disclosed. Part of HIPAA was the administrative simplification part, where it went in to standardize transaction and code sets, clarify the privacy rule, and really get into detail about security. PHI is individually identifiable health information that is transmitted or maintained in any form or format by an organization that is subject to HIPAA. If you still have your textbook from HIT 330, which would have been a year ago, it's a big, thick textbook. It's a white background. It's got oranges and reds on it. It's called Health Information Management Technology and Applied Approach, 6th edition by Sales and Gordon. It is published by HEMA. I would strongly suggest that you pull this out because they have a whole chapter on security. Data security is chapter 10, and it goes into a lot of detail about data security. And it does it in a really great way, very concise, easy to read, easy to understand. So if you're struggling at all with the textbook that we're using now for information, go back to this book from HIT 330. You're going to want to anyway, because in the spring, you'll be starting to prep for your RHIT certification exam. And the way that that exam is prepped for, it will ask you to go back and find the information from that textbook. So the sooner you start diving back into that textbook, the better off you will be. That is just a small, tiny sliver piece of advice. So back to these slides. A covered entity, we all know what that is. They transmit health information in electronic form. They are either a health plan, health provider, or a clearinghouse. The covered transactions are premium payments, eligibility claims, claim status payment, and remittance advice. And this is on, where did we want to talk about this? Where is it? bottom of page 218, top of page 219 is where this is covered in your textbook. So transaction code sets rule. That standardizes electronic transactions. It designated certain standards, maintenance organizations, and those are listed for you here. They're also on page 219. They allow for electronic data interchange, that sort of that interoperability, a piece of that. They allow for data elements and the formatting of data for claim submission. It's really all about making sure that the data that's being used is consistent so that it can be interchanged and it can be consistent. HIPAA defines a code set, and that is also here, bottom of page 219. The code sets that we often talk about are ICD-10-CM and ICD-10-PCS, CPT-4, HCPCS, Code on Dental Procedures and Nomenclature, which is CDT-2, and then the National Drug Codes. Those are the code sets that are standard. And whoops, I got ahead of myself. Sorry about that. And there you are. That's all at the bottom of page 219. The HIPAA privacy rule controls how PHI can be used and disclosed. This is all review. If you are not sure about HIPAA, again, go back to that textbook from HIT 330. There is a section on data privacy as well as data security. So I'm not going to cover much of it here. You can read about it or you can go back and refresh yourself. But business associates are subject to HIPAA. Some examples of business associates are listed there. Patients have rights under HIPAA's privacy rule. They have to receive a notice of privacy practices. They have to be able to inspect a copy and obtain a copy of their PHI. They have to be able to request amendments. They have to request alternative methods of communication. They have the right to do these things. The right for privacy, the notice, the right to get a copy and inspect that copy of their PHI, the right to request an amendment, right to have an alternative method of communication. They have the right to report privacy violations, and they have the right to request restrictions on how their PHI is used. But there is a caveat to that because there are certain things mandated by state law where they cannot restrict the use of their PHI, like to registries and that sort of thing. Public health, reporting of diseases and illnesses, that sort of thing. So security rule, the definition of security is the means to control access and protect information from accidental or intentional disclosure to unauthorized persons and from unauthorized alteration, destruction, or loss. So you have the physical protection and all that goes into that, that's listed here. And we have now moved into bottom of page 220, top of page 221. So we talked about the first definition of security. The second one is that the first one is the means, and the second is the physical protection. Covered entity has to address all of those aspects in both of the definitions. And the security rule defines the minimum a covered entity must do to protect the electronically protected health information, which is EPHI, or PHI that is created, received, or transmitted electronically by the covered entity. It does not, notice this, the security rule does not apply to PHI and other media such as paper, oral communication, and microfilm or microfiche. So notice that, that's really important. Voicemail, fax, and copy machines are not considered to be ePHI. Again, you need to know that. The security rule was developed to be technology neutral and scalable, meaning that with technology changing so fast, they wanted to keep it vague enough that it would cover new technology. Also, it's scalable, so whether you're a tiny single physician provider type situation or a multi-hospital health system that has like 60 hospitals across multiple states, it was designed to, again, be sort of vague enough and cover all of that. So that's what scalable means. ARRA, this is here on page, in the middle of page 221, talked about introducing new requirements related to security, such as certification of EHRs or that CEHRT, mandated HIPAA audits, increased severity of penalties, and said that business associates were subject to privacy and security regulations just like covered entities. We're now on page 222. What are threats? They are the potential for a vulnerability to be exploited. Vulnerabilities are weaknesses that could be exploited, thus creating a breach of security. And I'm going to stop here for a minute because one of the things I forgot to mention is as you go through here, you notice that there's some terms that are in a nice grass green color. Those you need to know. For your tests and when you're studying, make sure you know the definitions of all of these items that are in this green color, this bold green color in your book. And if you're not sure based on the context, you can go to the back of your book to the glossary and look those up there with a definition. So make sure you know those. So for instance, threats and vulnerabilities, those are two concepts or definitions you need to be aware of and have well memorized. Shall we put it that way? Excuse me. There are internal and external threats. Internal threats, they're going to go through those here. They involve hardware, the environment, employees. External threats, that could be hackers. It could be those who set up things like phishing, or they do ransomware. It can also be natural disasters, all those kinds of things. The goals of the security rule are to preserve confidentiality, maintain the integrity of the information, and make sure it's available. What are some administrative safeguards that you can put into place? And this is bottom of page 223. There's a nice table there that lists these out, talks about what the standard is and how you could implement that. What are the specifications to implement that? So for instance, on table 13.1, under security management, one of the ways you could meet the standard for security management is by doing risk analysis, risk management, having a sanction policy, and doing an information system activity review. So it just goes through all those, and it does that for each one of those standards. And it also goes into page 224. So notice that it's not just page 223, it's top of page 224, and you're going to want to read through that. The next several pages go through what those are. So it's going to talk about risk analysis, risk management, sanction policy, all of those. So I'm going to refer you back to your book for all of that because it's well laid out. Notice those green bolded concepts that you're going to want to know really well. And so again, back to your book for all of these. And let's see here. Yeah, it goes through all of these administrative safeguards. And then it's going to talk about risk management. And assign security responsibility. And this is at the bottom of page 225. You have to have a designated security officer or chief security officer. And that person is responsible for developing the security goals and objectives for the covered entity, determining how the goals and objectives will be met, advising administration regarding information security, determining reporting procedures, conducting adequate risk assessment, and determining the appropriate level of risk acceptance, and developing and monitoring the overall security program. So that's all of those. Then you go on to workforce security and how that plays out. And how important training is. And note here, you have to maintain your documentation for 6 years. 6 years. So note that. Hint, hint, hint. Note that. And then how do you manage a security incident? What happens when something takes place, no matter how good your covered entity is and what a great system, there's always going to be a security incident that happens. So how do you manage that? And this is at the bottom of page 226 going into page 227. And so this walks you through those steps that are laid out in your book. Explains what a security event is, what is an event versus an incident. It talks about how you need to have ongoing monitoring and evaluation of both technical and non-technical processes or processes. A business continuity plan. Make sure you stop on this. This is on page 228. Make sure you stop here and you read through this so that you're familiar with what a business continuity plan is and why do you have it and what is it for, and then how is that different than a contingency plan. It might be similar. What are the similarities and the differences between a business continuity plan and a contingency plan? Make sure you know that. Hint, 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 hint. All right, so on to data recovery, because that's the first step. When you find that you've had an incident, one of the first things you're going to have to do is figure out if you've lost any data, and if you have, you've got to get it recovered. So how do you get the data recovered? And this starts at the bottom of page 228, goes into top of page 229, and it walks you through that. What are those concepts? Then it goes into business associate contracts or other arrangements. This is the bottom of page 229. And again, we've had most of this before through other classes. This is just a good review. Technical safeguards. This starts on page 230 and moves on from there. What are your technical safeguards? We talked through administrative safeguards, but now we're getting into the technology piece. And so this is going to walk you through all of that. And again, your book has this all laid out very nicely, so it's really just a matter of studying it. You may want to use flashcards or Quizlet or write things out, take notes, those types of things, but make sure you know all these concepts. And again, access control systems authentication, types of authentication, user authentication methods. How do you make sure that that really is the correct user? What's the difference between one-factor authentication and two-factor authentication? How do you handle passwords? What are tokens? What about biometric identifiers? I've actually worked for organizations who have used biometric identifiers. And it's the ones that I worked for used palm scans and worked really well. Now, in this day and age of COVID, you'd have to clean the machine in between people, but they always did then as well. But it's really not that invasive. But the veins in your palm are unique, are individually unique, and so that's how they can get by with it. But there are other biometric identifiers. If you have a relatively new iPhone, it uses facial recognition, but that can be somewhat iffy if any of you have experienced that. Sometimes it recognizes you, sometimes it doesn't. And sometimes if someone is similar enough to you, it will recognize them in your place. So you have to be really careful when it comes to facial recognition, as well as voice prints, because some people are really good at mimicking someone else's voice, and that could also be a real issue. So retinal scans, fingerprints, and palm vein scans are a lot more likely to be accurate. There's telephone callbacks and automatic log-offs. Some audit controls, this goes through that. And this starts on the bottom of page 231, goes to page 232. Talks about how that works, what are audit trails and triggers, and how do you look through all of the information. What about data integrity? How do you protect the data from inappropriate modification or corruption, whether that's unintentional or intentional? That's here. Protecting ePHI while it's being transmitted between 2 points. Anyone ever heard of encryption? There are a couple of different types of encryption. And why is encryption important? Well, people can get in and hack in and take the data, and they can, and it's usually in a readable form until it's encrypted. Protecting data on a network using firewalls or VPNs. having an intrusion detection system. Those are all really important in the world we live in. And this is talked about on pages 233 and 234. All right, now we get into malicious software, also known as malware. It's designed to harm computers through email, downloading software, web pages, those types of things. And that's on pages 234 to 235. There are biomedical devices that are at risk for this, and so it talks about those. Viruses, worms, Trojan horses, and bots. That is all discussed here, as well as spyware, phishing, ransomware. And we're now on page 236 in your book. Physical safeguards, because we've talked about administrative, we talked about technical, now we're into physical. That's the hardware itself, hardware equipment itself. How are you, what are your plans and how do you protect it from natural disasters, tampering, theft, and fire, just to name a few. Flooding would be another one if you're in a building that suddenly floods. That's part of this. Limiting access to the data center and software, making sure that only the people who have a business-related need to do something are permitted in, and how you handle all of that. Workstation use, this includes PCs, laptops, mobile devices, and more. How do you make sure that those are safe? Tracking media that stores ePHI and appropriately disposing of things. How do you dispose of some of these things? How do you wipe them clean and make sure that nobody can get access? Do you crush them? Do you destroy them? Do you use some kind of chemical? This is all in here. This is on page 238 in your book. All right, so mobile security, talking about tablets, smartphones, and more. This gives you information about all of that. And that's on bottom of page 238 into page 239. How important it is to have a backup site in case of fire and natural disasters. What about penalties? Oh, unpleasant topic that is, but it's true. There are penalties for willfully violating the HIPAA security rules. There's 4 tiers of penalties, and those are listed for you in table 13.3 at the bottom of page 239. Certifications. You can become certified in healthcare privacy and security as a security manager, as a security professional, and these are all listed here and who provides those certifications. And these are references, and that is it. So hopefully you will have a great week this week. Again, we're on week 13, chapter 13. You have your discussion, 2 assignments, and a quiz over chapter 13. Next week is Thanksgiving. I wish you a very, very happy, healthy Thanksgiving with family and friends and loved ones. You have a discussion. You have an assignment. I will make sure that your chapter 15 lecture video gets posted before the end of this week so that you have that for next week if you want to work a little bit ahead. The assignment for next week, week 14, HIM Professionals in Information Systems, that will not open until Monday because I'm waiting for one more video to come in, and I'll get that posted as soon as I can so that that can open up soon. That is an assessment that the college mandates. In every class, we have 3 mandatory assessments, and we can choose what they are, but they're there for the college to look at how students are learning and if we're being effective as educators. And so this is one of those. So I'd really encourage you to do this. Not only is it worth 80 points, but it's important for us to know if you're picking up a lot of the things that we're hoping you pick up. This particular one focuses on critical thinking. So you'll want to be aware of that. And then we'll be back week 15 on chapter 14 to finish up. So I will talk to you again soon. Take care. Bye.